Michael Böhm chaired the first ESC 2011 hotline. His choice for best of went to the ARISTOTLE trial and to the PURE study.
Aristotle has provided another piece of evidence that new drugs like 10A antagonists and also thrombin antagonists are better than the conventional therapy.
ARISTOTLE is a large international double-blind clinical trial in which patients with atrial fibrillation and one additional risk factor were randomized to receive either the new oral anti-10A inhibitor Apixaban, 5 milligrams twice daily, or Warfarin. The results were jointly presented in Paris by Christophe Granger and Lars WALLENTIN.
We're very excited about the results of the ARISTOTLE trial because we have found in this 18,000 patient trial that this dose of Apixaban, an oral factor 10A inhibitor, as an alternative to warfarin and compared to warfarin, was both more effective, 21% relative risk reduction in total stroke, and safer, a 31% reduction in major bleeding.
We are presenting this afternoon also data that shows that Apixaban is advantageous irrespective of INR control. So although the event rates were lower in the European countries, still the benefit of Apixaban was consistent.
Good morning, ladies and gentlemen. It's my pleasure to present to you on behalf of the PURE investigators from 17 countries the results of a study examining the effect of secondary prevention medications in the community.
As we know, aspirin, beta blockers, ACE inhibitors, and statins are clearly proven to save lives, prevent heart attacks and strokes. So we looked at how frequently they are used in people after a heart attack and stroke in the community in 17 countries. And what we found was some very terrible news. And the terrible news was that the majority of people are not getting these treatments. This gap in effective treatment was there in the rich countries, but much more marked in the middle income and the low income countries.
It's a general problem of populations and not so much, or it's also a problem of medicine, but maybe we should switch the preventive interventions away only from doctors, but also to have official campaigns to implement better therapies for protection in high-risk patients.
ESC 2011 Congress Spotlight is the theme about controversial issues in cardiology. Left atrial appendage closure for secondary stroke prevention is clearly one, on which Horst SIEVERT and Francisco MARIN gave the pro and contra evidence.
Left atrial appendage closure is a technique which we are using since exactly 10 years now, and with the randomized PROTECT AF trial we now have the proof of concept that closing the left atrial appendage is really effective in preventing stroke. And basically the results of the PROTECT AF trial have shown that it is as effective as anticoagulation. There had been some safety issues with this technique because the procedure by itself may cause complications, but the extended experience with the registry, which was conducted after the trial, showed that these complications are mainly operator dependent, experience dependent, and they go down over time. So I think these are the main arguments why we now offer this treatment not only to patients who cannot take Coumadin, but also to those patients who just don't want to take it.
Studies arise some doubts and some questions because the follow-up is quite low, the cohorts are small, some important type of patients are underrepresented. We need new studies with robust, great data to begin to use this device. In my opinion, oral anticoagulation is still the best option.
Percutaneous mitral valve repair might become a new option for patients resistant to cardiac resynchronization therapy. At ESC 2011, Angelo AURICCHIO reported the first results from an evaluation conducted on 51 patients with advanced heart failure.
What we have seen in our trial was the fact that we have physically measure that a significant reduction of the quantity of regurgitation from the ventricle to the atrium. And this effect is not an acute one, so right after the procedure, but is maintaining and staying and getting better over time. As a consequence of this regurgitation, most of the patients, they do feel better, significantly better. They could walk again. Indeed, the functional class was 1 to 2 in about 70 to 80% of the population. And this was also achieved at a relatively low price of death rate, which we have to pay in this group of patients because they are very compromised patients.
We are just in the middle of the University Hospital of Liège, which was a hospital opened in the 80s and where I had the pleasure to start a new service of cardiology. In the academic curriculum in Liège, I had to make a thesis at some time. And among the members, the foreign members of the jury for that thesis was Paul Huguenot. I shared his opinion that one had to revigorate the European Society of Cardiology.
Paul Hugenholtz and Henri KULBERTUS then became members of the ESC board. At that time, the ESC Congress was held only once every 4 years, and Henri KULBERTUS managed the transition to an annual meeting, as it has been ever since.
That was an extremely interesting work, and I think that these meetings trained the minds and prepared the mind of the society to the concept of the annual congresses that we have now since '88.
Henri KULBERTUS is not only a remarkable cardiologist who's contributed to the evolution of cardiology and of the ESC, but he's also been deeply involved with medical publishing, starting with La Revue Médicale de Liège.
In '84, I then became editor myself, and I stayed there for 20 years.
It's very easy to work with him because he's precise and he helps us for our work. So the 10 years I was working with him were the best of my career.
Internationally, he played a leading role in the creation and development of the European Heart Journal, for which he was the editor-in-chief for 5 years.
This place is on university ground. I can't say that the journal was born here, but it was conceived here. It was only after 8 years that they asked me to take the editorship, which I did with pleasure. After a few years, Huguenot thought of linking the subscription fee to the admission fee to the annual Congress. And from that moment on, the journal simply exploded. And I think the successive editors did an excellent job and strengthened the journal to give it the form it has today. Well, I was very surprised by the announcement that the gold medal was going to come to me this year.
Écoutez, je crois que c'est mérité et je crois qu'il est très très content. Cette reconnaissance lui fait certainement plaisir et je remercie les personnes qui ont pensé à lui.